We're on. Hello, everybody. This is Cindy Kennedy, and I'm going to be talking with the none other Jocelyn Strand. And she is no stranger to the podcast. She's been on with us before because she's the clinical educator for biobotanical research. She promotes biocidin, which I do as well because it is an amazing set of products. Anyways, Dr. Strand is a naturopathic doctor. She's a graduate of Bastyr, and she's here. We're going to talk about one of the underlying problems and why people stay sick so long, and it's this inflammation, and it's driven by things that are either genetic or influenced by our environment or certain toxins and certain infections. So welcome again, Dr. Strand. How are you today?
Hi, I'm good. How are you today, Cindy? Just call me Jocelyn.
Dr. Jocelyn. It's funny because I just got an email from someone just thanking me, for doing the podcast, making it nice and easy and an access. And they said, but we're wondering what happened to all the lawnmowers. Well, if you go back in my podcast, notoriously, they're cutting the lawn behind me. And I'm like, I have to stop and say, oh my God, I'm so sorry. They're cutting the lawn. I hope you guys can hear me. We'll pause for a second here. But I've been doing the podcast in my office now that I'm brick and mortar. How wonderful is that?
It's marvelous.
It is. So let's get into inflammation. It's really a problem. And we know, during this time with all the infections of COVID, people who have this underlying inflammation and may not even realize it or do not understand that their diagnoses of diabetes or hypertension, cardiac disease, etc., are a big inflammatory response. So can you explain a little bit about inflammation and what's happening?
Sure. So, and I think this is where I think that we are gratefully poised as practitioners, to be able to support some of the basic ways that we can support any of our patient base in potentially responding way better to anything that they come across, right? In terms of infectious organisms, if we can support them reducing their infectious load. So we get inflammation for a number of reasons. It can be a food sensitivity, it can be toxic load, it can be eating too much sugar, it can be elevated stress, not getting enough sleep. So I really think kind of diet and lifestyle is really where it stems from primarily, right? And then we will get an exposure where if our diet and lifestyle were sort of righted around and we were getting enough exercise and relaxing enough and we had good community, all of that our body handles it. So we get inflamed for a short time. And then we get through it, we move through it, we're done, we've kind of gotten on top of that infection and we've moved forward. But when we have the sort of chronic low-grade stress that we always have, or high-level stress that a lot of us have, and our diet and lifestyle is off, maybe we're drinking a little too much alcohol, maybe we're, home quarantined at home, right? And not, and leaning a little bit on wine in order to help us with our stress load, whatever it is, that our cortisol, our stress hormone levels start to creep up a little bit. And then cortisol is like prednisone, right? It's like a steroid, and it will keep our immune system from functioning effectively. And so what happens then is all of these things that we've come into contact with through our lifetime can start to sort of rise as a low-grade smoldering source of infection and inflammation, right? So inflammation, I think of primarily. Of course, I'm really geared towards the microbiome because it's what I've studied the most and what I do in my work, right? But that's a major source of chronic inflammation is the microbiome in the gastrointestinal tract. So if we get our immune system stops sort of doing its job of staying on top of monitoring what's growing in the gut, maybe we're eating more sugar too, right? We're feeding those pathogens, the gram-negative bacteria that produce things like LPS, or gram-positive bacteria can produce LTA. So these are all microorganisms. Okay, I'll time.
Tell people what LPS and LTA is.
Okay, LPS is a lipopolysaccharide, and it is produced, it's an inflammatory mediator that's produced in the cell wall of gram-negative bacteria. And so when we get overgrowth of those microorganisms, it ends up increasing our inflammatory load, right? So it increases inflammation in the gut, then that translates to systemic inflammation as it's absorbed in, and it actually causes damage to the lining of the gastrointestinal tract. And then we can get this sort of transfer of all of the inflammatory mediators that are in the gut across to the bloodstream. LTA, I do not remember what the acronym is, but it's kind of the equivalent of LPS that's produced by gram-positive bacteria. So it's also an inflammatory mediator, and we all have some of that. We will all always have some LPS and LTA produced in the gut unless we have a sterile gut. So if they, like in rat studies, they'll knock out the microorganisms in the gut and then they don't have LPS circulating anymore. But LPS circulating, just to give an idea of how important this is, if it increases, it's considered metabolic endotoxemia, meaning that we are toxic inside our body, and it's toxins that are being produced, and it triples our likelihood of cardiovascular disease. So increasing that level of LPS it's really damaging over the long term to all sorts of, we think of cardiovascular disease, it's the #1 killer in the United States, right? But it's caused by inflammation, ongoing inflammation in the blood vessels. That's just one area where LPS is causing issues, right? So it does damage the blood-brain barrier, will cross into the brain as well. It contributes potentially to Alzheimer's disease and dementia. So it is important to try to keep it down and keep the gut healthy so that we can keep that LPS at a lower level and where it belongs, right? We want it to stay in the gut, not be transferring into the bloodstream and causing damage there as well. And so I could go on and on, but I don't know if you want to direct. I'd like to at some point relate that to the importance of, or why inflammation is so important for people with chronic illness, and how to and how it interferes with our immune.
Yeah. I just want to mention to anyone who may be learning about this topic and then presenting it to conventional medicine, it might be poo-pooed, and it's unfortunate, but do understand that there are a lot of research studies and the promotion of good gut health out there. And even some conventional doctors are really beginning to open their eyes and understand how important the gut is. So don't feel that you're not being listened to. You just might have ears that are a bit closed.
Yeah. I think
Okay. Now you're on. Hit it, Jocelyn.
There's so much research. In the medical literature, there's so much research connecting lipopolysaccharides to inflammation and to chronic illnesses. And we don't just make it in the gut either. Actually, we make LPS. We don't, right? But the gram-negative bacteria, if we get an overload in the mouth, that can also cause it, right? So if we have periodontal disease, that is so close to the bloodstream there that you'll get direct transfer also of LPS from a periodontal pocket if you have an infected periodontal pocket. And that's, I think it's 78% of US adults over 30 years old that have some degree of periodontal disease, right? So that it is really important aspect. And I think we're really focusing more in on that all the time in research, but also realizing as a company that the oral microbiome plays a huge role in our gastrointestinal health, in our pulmonary health. So we can talk about that some too. I'm making notes as we talk so I can come back to it. Oral, because otherwise I'll.
It's true. I talked with, oh gosh, I'm having a blank. One of my other guests, and he was talking about wherever he lives, they have really poor oral hygiene, and it might be because of, I'm not sure if it's lack of availability or it's just not a priority to these people. He said before he can even start in on any treatment, he has to work at reducing this amount of periodontal disease in the mouth. And I know for a fact that he does use the biocidin. He said and that's in a toothpaste. And I believe you have the mouthwash too, right?
There's Dencidin, which has biocidin in it as a toothpaste. And then there's the liposomal rinse, oral rinse. So it's
right. Right.
Yeah.
And he says that he can't even allow them to brush their teeth, and that just goes to show you that people with oral issues can end up with a cardiac issue in the valves around the heart. That's an infection because of that amount of bacteria being dumped right quickly into the bloodstream. So
Right.
anyways, I love the products that actually improve, and they're safer and they're better, and you can use it, for your whole family. So
And they taste good, so and
no.
it's everybody's already doing, we're all already brushing our teeth every day.
Right.
So bringing it in doesn't increase supplement burden.
No.
It's an easy way to start to modify. We know there's research showing that people who brush their teeth more often have a reduced level of yeast or candida in their gut, dramatically reduced. And so it's proof positive that what we swallow, right, translocates, so moves from the mouth into the gut, where it can either support our health or it can contribute to dysbiosis, or that dysbiosis being that unbalanced growth of microorganisms. And so it is an important place to pay attention to. And it's something I wish I'd known more about sooner, in my practice, because it's not an area when I was in clinical practice that I focused a lot of attention. But now, having learned about it and talked to other dental practitioners, understanding it more as a really important foundational health support, it's pretty interesting.
Yeah, it is. And do you know what dysbiosis is? It's not datbiosis. I don't know. It's obviously my forte is not complete stand-up comedy, but I try to find some humor in something, because you know
Uh,
you got to be real. And people who walk around really unmindful and unaware of just the beauty and the humor all around, I think they're just going to stay miserable their whole life. But anyways, back to the matter at hand. So tell us more about your notes that you're writing down.
so what I think is really interesting way to think about this, especially for people that already we know have a chronic or a persistent infection of any kind, with that mildly elevated inflammation. What happens in the body is that, so you imagine that you've got inflammation, say joints and gut, that you have this sort of chronic inflammation that's circulating. Well, that's actually, inflammation is a signal in the body, right? So it's one of the ways that our body communicates. So the microbiome participates in that. So if we have a healthy microbiome and it detects, say, a virus that comes into the body, it will start to basically sends up a flare, hey, over here, and it uses inflammatory metabolites to do that, right? So it's saying, with the same metabolites that are circulating already, it's trying to say, hey, look at me over here, to the immune system. And the immune system can't hear it because there's already flares going up all over the place. So it's just, when you say it that way, it's like, oh, of course, it's common sense, right? It just makes sense. So instead, what happens is that viral infection, in this case, I'm just picking viral, it can be anything, right? Viral infection will grow and grow and grow until it's basically a house on fire before the immune system detects it. And then the immune system has to come in with full, now we're not just here to help, we're actually in here with fire trucks, we're blowing the place down with high powered hoses, and that's what we can see happening with this response, where you see someone who's immune suppressed and also has this sort of elevated or exacerbated inflammatory response that goes haywire and then causes damage to the surrounding tissue. So it's really interesting, because I think it's hard, I think, as a clinician, but also as a human, just to understand, how can someone be immune suppressed and inflamed at the same time? Like, how does that happen? Well, we're starting to understand that better. And it's really because those signals can't be detected in a healthy way by the immune system. So bringing that inflammation down, super important, right? And so we can talk about what that looks like. We can talk about the microbiome as one way to do that. It's only one way to do that, right? Is to bring down LPS and LTA and other inflammatory mediators from the gastrointestinal or the oral microbiome. But we can also, there are lots, and I would actually defer to you as well, or love to hear what you recommend in terms of anti-inflammatories and, so helping quench that free radical damage.
Well, I'm thinking of myself. a little bit here and thinking about what I went through before I learned what I do, know now, and the amount of antibiotics that I received for my Lyme treatment without ever really paying any attention to anything else in my life. And you talk about the gut. I mean, that was never really addressed except take a probiotic. Well, no one talked about what the important type of probiotic to take, that it should be multi-strain. No one talked about my diet. Just the kill. Just kill, 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 kill. And problem with that, when you kill, 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 you kill all the good stuff as well. And so part of my protocol, I mean, I talk about pillars. I always call them pillars. And I look at, okay, let's talk about, are you moving your bowels? How often are you moving your bowels? What are they like? Do they float? Do they sink? Everybody's like, why do you ask that? But, that's important because we need to know the consistency and whatnot because we have clues. I talk about stress a lot. And the fact is, when you're sick or you've been sick a while, you can't help but feel overburdened, and you may not have the support at home. So we talk a lot about ways to lower that. Even some deep breathing 3 or 4 times a day can actually help, and talk about being mindful. We talk about movement, like, can you exercise? If you can't because it's just too much on your body right now, can you just walk? Take a short walk. We talk about ways to detox, whether it's Epsom salts baths or coming into the center and using the biomat, which is more gentle because it increases blood flow. For those that can tolerate it, we put people in the sauna and have them, get some detox by sweating. And just, even if they're not sweating and they're heating their body, they're helping their immune system. We talk about nutrition, because food is medicine. And part of my practice, everybody gets to see Kara, who is actually my oldest daughter, and she is a registered dietitian, but functionally trained. So we kind of go through all of these steps, and then we really assume that most people who are chronically ill have this leaky kind of gut, and we work on balancing that. We work on healing that. If we've got people that have a lot of reflux, heartburny stuff, we start thinking about maybe they don't have enough hydrochloric acid. So then we kind of work on some digestive enzymes, and that we look at, geez, do you or do you not have a gallbladder? And if you don't have a gallbladder, well, we might need some bile salts. So we may look at that. If I've got somebody that's not horribly anxious, I might add a digestive assistant healer with some glutamine. And over a period of time, we layer things in. And, people are like, well, what are you going to do? Well, one thing at a time. It's a cascade that got you here, the snowball effect, and we're going to now let some of that snowball melt. I like that analogy. I just thought that up. What do you think?
I think it's good. I think about it like this, like for me, I've been around almost 50 years, right? So I think there's been a lot of years where I've got a lot of work to peel back. But I've been expecting my body to go, function, perform, despite poor choices, right? No matter what. I mean, I have a pretty healthy diet right at this point, and I'm pretty determined to get my sleep every night. So I have.
That's a pillar too. I forgot that. Sleep is so important. I forgot that. All right, sorry to interrupt.
That's okay, but I mean, it's just a lot for us to expect of our bodies to be. I think we, as a culture, just demand. I'm gonna eat this way, and my body should look this way, and I should feel this way, and so I think we expect a lot of our bodies, and sometimes we just hit that point and where our bodies can't handle it anymore, and it says it's throwing up its hands like we can't, sorry, and so it does take some time, and it does take some commitment, and it's hard. It is hard. It's hard to ask, I think, patients who already don't feel well. Like you said, who already may feel overwhelmed, and not, patients who have been sick for 20 years with Lyme disease, who it's the best that they can do is just to get their supplements in every day and maybe walk around the block. That's all they can do. Maybe feed themselves, get their supplements in. and some can't even get their supplements in. And so then it does become really difficult. So supporting yourself in these basic ways, and I think I am trained as a naturopathic doctor to think our bodies can heal themselves if we give them what they need, and identify the obstacles to their healing. And I do think it's often in that stress response, or that, the limbic system. And just when I say limbic system, what I mean is that we get trained, we get sort of super highways of stress response in our bodies, especially after people have been sick for a long time. And I think addressing that can be really powerful too. I mean, I've watched that with some patients. I think, do you know DNRS, Annie Hopper's stuff?
Well,
Dynamic.
I just was gonna talk about that, because I've got somebody that I said, maybe this is your next step, because I mean, some people who've been sick for so long, no matter what it is, whether they know it's Lyme or whether they still don't know what it is, they get caught and they become their whole persona is what they're thinking, breathing, whatever is their illness.
Right.
And you got to step back. And I know when I talked with Dr. Neil Nathan, he said when he talks to people and he gets the sense that something like this is going on, he wants them to immediately do her training and work that pathway before he really dives into what they need on a kind of physical level. And I think
Yeah.
that, how we do spa days and we get our nails done, or, it's a haircut day when you get hair therapy. I call it hair therapy when you go and get your hair done. I think we all need to take a weekend and I'm really not familiar with all the avenues of her training, but I think we all need that, especially as practitioners, because we lose our mojo, right? It's a lot to do. It's a lot to think about. But I think we need mini series on that. What do you think? Tell us a little bit more, because actually I've not had her on the podcast, so I haven't had the opportunity to learn from her.
Well, I think it's pretty remarkable, the people that I've been in communication with that have done her process. And I started, I haven't finished it yet. But it is for me, the very first thing it did was I went in with a certain, she talks about trauma loops, basically, where we have something happen to us and we get stuck in that trauma loop. And I went in thinking about one trauma loop, and then I very quickly realized that there was a trauma loop that had been existing with my entire memorable life that was really internal, like fully internal. So, and something that it was affecting me every day. For me, it's related to food. It comes with all the food sensitivities, and it's part of the reason I'm doing what I'm doing, right? Is because I didn't feel good and so I searched out, finally found out, take out gluten. But for me, I know this is maybe not where you want to go, but I'll tell you my own personal.
You know what? I think people like to hear the real person's story. I have a friend who was a past producer of the Today Show, and she says, Cindy, people like to hear the story behind the human person and what that human person is dealt with, because they associate it, they feel it, they know it, and they love to hear it, because people need to know what you've gone through and how you kind of got to the other side, or how you're working to get to the other side. Whoops, I hit the video. Whoa. Okay, tell us without being, I don't want you to feel uncomfortable, but tell us what you'd like to tell us.
I'm an open book. I don't mind at all sharing about my own journey. And I would say I'm in process, that I'm not on the other side of it yet, but I think I've made a lot of progress. So for me, it was starting at a young age, thinking, I have a twin. I was the chubby twin, right? When I was growing up. And so from a young age, even in second grade, I was on a diet, right? And so then it was every time I was eating something like a brownie or whatever, right? I would punish myself, right? Mentally. So it was like, as it's heading towards my mouth, I'm thinking, I shouldn't be eating this. I shouldn't be eating this. I shouldn't be eating this, right? This is going to make me fat. This is what it was going on in my head. And I realized that has translated through the years as if I fall, and then you imagine learning about nutrition and all the different diets out there, vegan, paleo, keto, like I've tried all of them, right? I've done them all. And at the end, there's nothing left. Like there's literally nothing left to eat. Like I can stand and look at a refrigerator and think, I don't even know which foods are good for me anymore. I'm better than that now, but there's been a time where I'm like, I know I reacted to that on testing, and that one's out because of paleo, and that one's out because, of blood type or whatever it is, right? And so you end up being so restricted. So for me, my trauma loop was food is bad for me. Food is like all food. There's literally nothing except for maybe a cucumber where I feel good about eating it. Does that make sense? Like I was in this constant trauma loop where I was punishing myself every time I put something in my mouth, or convinced it was going to make me sick. So I had this aha moment starting that program where I realized that my food sensitivities are probably a part of that, where of course, if I'm thinking every time I eat something, this is going to make me sick, this is going to make me sick, or this is I'm not going to feel good when I eat this, or, this is not what, all of that. So I basically created that in my own health. And so I have noticed a difference already, just even going through a few days of it. Even I think that awareness of what was happening, it's been very, very powerful for me. And it's only been about 3 or 4 months since I started looking at it. So we'll see. We'll check in a year or two and see where it takes me. Yeah. I'm hoping that if I can work that, the first thing is to never talk about it again, like basically to never identify with it again, like you said, which, I'm doing when I have this conversation. But my intention really is to try to help other people with it, because it's a huge deal in this culture, the way our body looks, the judgment around it, the assumptions that people make if you look a certain way, that you don't have willpower, that you don't care enough, that you don't exercise, all of that stuff. There's so much pressure to be a certain way, and stress, right? It's stressful. So that's been my particular personal journey with it. And I'm really hoping, actually, after starting her program, so a call out to Annie Hopper. I'll let you know how it goes.
Yeah, don't look up Cindy Hopper. I don't think you might end up with Cindy Lauper, not Hopper, but
there we go.
Yeah, maybe I can get her to do a podcast soon. I'll try to reach out. It's true. It's the underlying things that are hurting us. I mean, you've heard of people who become this spiritual believer in self-healing, and all of a sudden their horrific cancer diagnosis, they can't explain where the cancer went, but it's gone. It takes someone really, you gotta be really diligent and real strong-willed. But again, you've reaching inside and finding those triggers, those evil voices that we all have, and becoming, you really got to search for the authentic you, and our negative thoughts and then our negative, recycling of our words and whatnot is harmful on all kinds of levels, especially, healing.
Punishing inner dialogue, right, is what I found. And I knew that, but I didn't quite get the depth of it until I started that program, and I realized that it's everything. I mean, it literally was everything that every time I was eating that I.
That's tough. That's real tough.
If the whole thing I'm thinking every time I'm eating is it's going to make me sick, like food cannot nourish a person if they think that, right? So that's where I'm at, on that journey, trying to figure that out. I feel like I humbly will say it's a major piece of my healing. I'm sure there's always another layer after that, right? There's going to always be more. I'm not Jesus or Buddha or Krishna. I haven't ascended yet. So there's obviously more work to do, but anyway, so do you want me to go back and talk a little bit about I don't want to forget to mention another important part about the oral microbiome.
Okay, go ahead. And then I want you to talk about the importance of a healthy gut for an immune system.
Yes. Okay.
Yes.
Let's do that. So this piece will be pretty brief, is that there is a microbiome in the lungs as well, which we didn't learn about in medical school when I was in school. So that's important, right? So we have microorganisms that inhabit the lungs. They are most closely associated with the oral microbiome. So it makes sense from anatomical proximity, but really the theory is that when we lay down and sleep at night, as we relax, our reflexes, like our cough reflexes, relax, and we'll do a little bit of inhaling or micro aspiration of our saliva and what's in our sinuses and all of that. So this is an important piece, and there is a new article out on COVID, which I want to be really clear, I'm not making any claims at all for biocide. And on this, I just thought this was an interesting, more than interesting, like really almost stunning, that the people who are at the highest risk for COVID complications have an altered pulmonary microbiome.
Really?
So a way that we could, this is what I mean when I say like, we could maybe really support someone who is ideally we want them changing into healthy diet and lifestyle and lowering their stress and sleeping well, but at the very least we can work on the oral microbiome, and maybe that could affect some change in risk for those people. So that's a research article that just came out. Also 100% of people with lung issues have an altered pulmonary microbiome. So this is an area where we know that we could potentially affect change for our patients, is to support the oral microbiome and then eventually downstream effect of supporting the pulmonary microbiome as well. That the same is also true that people who have serious lung conditions, 70% of them have gastroesophageal reflux. So not just the oral microbiome, but it can come up also, right? So we think of it being related to the gut health as well. And then so that aside, I think of reflux very often associated with dysbiosis, of course, in the gut, because we probably don't have good release of bile salts, which are antimicrobial and really hold those pathogen, keep that pathogen load in check as well. So that aside, you're asking me about the immune system in the gastrointestinal tract. So I think most of us have heard that up to 85 or 90% of the immune system actually resides in the lymphatics in the gastrointestinal tract, right? So that alone, just that piece of information makes it clear that we need a healthy gut in order to have a healthy functioning immune system. But if we want to talk a little bit deeper about what happens there, is that we have these immune cells that live on both sides of the gastrointestinal tract. So they're long, skinny cells. They're called phagocyte, which means that they basically eat things and suck them inside, right? So they go through and they eat particles. They will suck in food particles, bacterial particles, viruses, whatever as it goes through the gut. They do a sampling, and they go across the lining of the gut and towards our immune system, which is called the lymph nodes, the mesenteric lymph nodes in the gut. And they bring it in. It's called immune priming. They suck it in, they bring it to the other side, and then they prime the immune system. So the immune system basically develops a little artillery around it. So let's choose a bacteria, right, that we swallow through our postnasal drip. We talked about this last time, right? So some of that postnasal drip kind of going down into the gut, and the mesenteric, or excuse me, the dendritic cell, which is that phagocyte, is part of our immune system, samples that a bacteria that's in the sinuses and pulls it in. And then we start to develop like a whole artillery against it, a whole army against that, but it stays there. It stays in the mesenteric lymph nodes because we don't know yet. Is this going to be a problem? It might not be, right? So if it's not a problem, then nothing happens. It just sits there. But if it becomes, so say we inhale some of that and we start to get an infection in our lungs, the cells in the lungs will actually go to the mesenteric lymph nodes, so down to the gut, where the lymph nodes are, where our immune system hangs out in the gut, to where it's been primed, and recruit all of those cells, those immune cells that have been produced, to respond to that bacteria and bring them back to the lungs, where it will attack and take charge of that infection. So that's true in the lungs. It's also true other systemic areas in the body, on the skin, all of that. So really interesting. I mean, I just think that's so, I'm always like, man, it's amazing design. Our bodies are incredible. It's so amazing. What our I mean, that's like really basic too. It gets way more complicated than that, so I think.
Well, just think about trying to study that and actually see it or watch it happen. It's almost like you really need a window and a supercharged microscope to kind of watch that happen. And it's so funny as you talk, in my mind, I'm seeing it all play out in cartoonistic kind of form. I think we were talking beforehand about learning, and I'm a visual learner. I need that a little bit of auditory stuff as well, but don't ask me to read it because that really is more difficult for me. But watching and having that memory of the Pac-Man being the phagocyte, and maybe a little train coming down to pick up those immune cells and sending them right back up to the lungs. I mean, it's so good to know it that way, because it's not necessary to have the all the way down to that huge extreme biochemical, because no one really, only if you're like of the brilliant minds and doing all these studies or whatever, that they really care and need to know that. You don't need to know that. And
Right.
people don't need to get caught up with that. If they can visualize the little train and all the Pac-Man, and it makes sense to them, and it makes sense to me too. I rather learn it that way.
And I think I'm one of the people where I sometimes go a little deeper than it even serves me, and then I don't remember it anyway. So it's like, I mean, it's a good understanding. I think it supports the base understanding, but I can't whip out all of the metabolites that are involved there, and which cells. I mean, I know B and T cells, all of the immune cells are involved, but there's all of that biochemistry and the physiology that's involved. So it is fascinating to me, but it is very, very complex. And
Right.
all we really need to know is that if we have a healthy gastrointestinal tract, a healthy microbiome is a huge part of a healthy gastrointestinal tract. And that if that's healthy, then those dendrites, those dendritic cells, those cells that are sampling what's coming down the gastrointestinal tract, they will be healthy and they will be able to do their job. So the takeaway is, we need a healthy gut to have a healthy functioning immune system.
And we need a healthy mouth. So let's get on the train of making some changes. If people listen to this and they are like, the light goes off and they're like, oh my God, I'm going to change everything overnight. Well, that becomes extremely taxing and overwhelming. So you pick apart, you pick one thing and you say, okay, I'm going to start this. And then maybe you write some goals on the paper. In a month, I'm going to do this. Or by a month, I'm going to cut down on sugar. I'm going to get rid of all my fruit juices, and I'm going to convert to water, maybe cut it with some seltzer or squeeze some lemon or lime in it. And I'm going to, have less, I don't know, I'm not going to eat desserts, or, it's one step at a time. Because if it's overwhelming and you can't do it, then you feel like you failed. And we don't want anybody to feel that way. We want people to make better choices, but you do it through education and learning and reaching out and looking at what you can find. Of course, there's a lot of crap on the web, but something like Healthline, they're pretty, I like what they write, so I usually suggest that. And making an appointment with a more holistic or functional practitioner, even as a preventative. I love to see people who are coming in because they want to feel the best they can. And we either talk about, in general, what's missing in most people's diets, and, what type of supplements are actually a good base to use. And then I've got people that come in and they want, okay, test me. And then they come back and we review the tests and they leave with a plan and everybody's happy. But it all starts with prevention.
Definitely. And it is, I mean, I think that sleep piece is so important, and for stress. So even making a commitment to, no screens after 9 p.m., something like that. And so that people can fall asleep more easily. They're not, circumventing their melatonin, all of that stuff. And I mean, we live in a stressful time right now. Like there's just no way, there's no way to avoid some level of stress over what's going on globally right now. So that's another piece, is supporting that. I mean, even if it's for me, well, we don't need to go into that, but I think that again, that stress response, making sure, I love the deep breathing and, you know, meditation, even if it's for 5 minutes. Or I think waking up first thing in the morning when people wake up, taking 5 minutes just to set the stage, you know, find gratitude for the things that they are grateful for, to set the stage for a positive day. That can be a huge piece as well.
Right, right. Most people really, oh, my life sucks, you know, it's really bad. Or all these people are like, this whole COVID thing is a conspiracy. We don't really need to wear masks and stuff. Well, it's not, you know, you don't get it until you get it, right? So if all of a sudden, that's the same thing with Lyme disease, you know, all these people who really think it's just bacteria, it's just like any other, you just treat the person with the antibiotics for 14 days and everybody will be fine. Well, they're missing the boat, because it's not just that, it's all what we just talked about. And if the stage is not set, it's kind of like your garden, right? If you get this patch of dirt and you're like, I'm going to grow a garden, and you just cast some seeds in it, but you don't water it, you don't make sure there's some good, you know, cow manure and whatnot, you're probably going to get a poor crop. But if you take the time and you're weeding it and you're tending, you're watering, etc., you're going to get a more healthy crop. And it's really about the way we take care. And, you know, one of my biggest things, and I tell people this all the time, and it's probably the maddest I get at people, I say, listen, you probably take care of your car much better than you take care of yourself.
Mm-hmm.
Correct? When the red light goes on the dashboard and it tells you something's going on in the engine, you'd never think to just continue driving. You would bring your car in, because why? You need it to be reliable. And we
Right.
get that about our bodies. We
Right.
have to, oh man, I'll tell you, I spent so long being so sick, and just I felt like I was a sewer. I was so toxic. And it wasn't until I just said, I'm going to stop all this nonsense, I'm going to take a break, I'm going to go back to square one with the nutrition, and, you know, doing those steps that really, you know, was overwhelming at first. But, you know, once you start to feel a little better and you get things under control and you feel supported, you know, when you don't have that support, that increases your stress. And I
Mm-hmm.
talk to a lot of people who are in bad social situations, family situations, and yeah, it's hard. How do you recruit friends? You know, wanted 3 friends to listen to me complain, you know, I mean, what do you do about that? Right?
Yeah, and some people can't afford, you know, the care or the products, especially if they've been disabled, you know, for a long time by illness. So yeah, it can be a very tough situation.
Right, right. I'd love to see a program from each of these manufactured companies, you know, like what did I see? Oh, if the COVID crisis has affected your financial situation, AstraZeneca may be able to help you. Well, how about, you know, pure encapsulations jumping up? How about research nutritionals jumping up and helping people out? You know, they should have some type of grants or scholarship kind of stuff based on people's financial, you know, can you help these people out? You know, I mean,
Do
look
that.
upstream. How much are these bigwigs in these companies making? Are they raking in the money, and can they do with a little less to make it better for the people who really need to get better?
Rachel does provide scholarship product, just so that you know,
I
for
did not know. That's awesome.
that they need to be working with a practitioner, but she does provide, you know, 2 or 3 months supply of whatever the practitioner and the clinical consultant at our company settle on as a potential treatment plan.
Yeah, you know what? She's just lovely, and she's witty. Rachel Fresco, that's who we're talking about. I got to meet her back before, I mean, she was doing well, but not I mean, then it took off like crazy. And she's actually, your company is a sponsor for this podcast, which I'm so grateful for. But, before I forget, for all you listeners, if you go to www.pursue, P-U-R-S like Sam, U-E, wellness.us, like United States, and you go to the store page, you'll see my Full Scripts account. You can click on that. You can open up your account. It's discounted. I make sure that there is a discount. And you can actually purchase your Biocidin products, your toothpaste and rinse, and one of the biggest things that I think is great, and Jocelyn, you can give us a quick detail on that, is the oral spray. And I know that you did research with athletes. One of your first line of defenses, people, is your secretory IgA, and that is what responds very quickly. And by using this oral spray, and you can use it with your kids too, can actually help promote that, so that, hopefully maybe this would be a great way to prevent colds and things. So can you tell us a little bit more about that?
Absolutely. So the throat spray, it was a 66% increase in 60 minutes of IgA in the oral mucosa after using the throat spray. So that was it's published human clinical trial, which is the gold standard, in our industry.
Right.
That immediate response, it did drop again after 2 hours. So I was misinformed on that. I thought it was sustained for 2 hours until recently, when I delved in deeper and read the whole article and did a presentation on the article at a conference. And I think that's important because I think it changes our dosing recommendation, right? So I think it makes sense to use it if you feel like you can use it when you're going out and about, right, in order to support IgA, right, or so your immune response in the body in case of an exposure. But you can also, if you, like for me, if I feel like I've got, a sore throat or anything going on, and I have it right on my desk, then I will use it every hour or so. I'll do 3 pumps of it every hour, and it's nice. It's a low price point. It's a nice price point, and it's just easy administration. Kids tolerate it really well, and it's kind of a game changer for people who travel and for
the travel. You talk about wearing a mask and sanitizing your hands. Well, give a couple of squirts. It's really, and again, it's tolerable. It's not like putting poison or spraying Lysol in the back of your throat. That's a whole nother story. Really, it's not a personal one, but it's a story that I heard once before, and I don't care. You don't want me to share that. Talk about not being educated, but thinking, hey, this kills 99% of the flu virus. Let's just spray my kids with it. Oh, jeez.
That if listeners are interested in working with their microbiome in their gut, then the product for that is the Biocidin liquid. And you do need to be aware. It is best if you are working with a healthcare provider when you do that. If you have a history of being, sensitivity, mold or Lyme or anything like that, because you will end up potentially creating a die-off or Herxheimer reaction with that. Yeah. So the other product that Rachel has developed is a formula binder that is broad spectrum, just like all of her products are formulas, so they're broader spectrum for that reason, and typically gentler too for that reason. So that can help kind of mop up or soak up some of that. So I just like people to know, I just don't want someone to get off of this podcast and then go and buy Biocidin and then get sick from it and think it's the Biocidin. It's actually the Biocidin doing its work, but then using that GI detox or another binding agent, whatever one you like, to soak that up so that you're not getting, so that you feel okay or good while you're working on cleaning up.
Right. Now that would be something we could do when you're not so busy, is to do a little in-service for people who really are interested in doing that, but are not wanting or needing to get to one of us to provide care. That might be helpful. And so certainly, if someone is really interested in this, reach out to me. I can provide some information for you if you wanted to try it on your own. There's a few nuances, of course, that you should be aware of, such as that the GI Detox has charcoal in it. Can't take it anytime near your other supplements, or it'll mop that up too, and you're not going to get that benefit. But we also add in the oliverics, and we also add in the probiotic as well. But there's kind of steps to do that, and it isn't something that you have to have 100% of a problem. It can be something to use as basically a gut reset. So it's great.
Yeah.
Yeah.
Yeah. Amazing. And I actually have I don't know if I can, are people going to be able to see the screen too? Do you want me to share a slide with?
I will be putting all of these out on my YouTube channel, slow but sure. Yeah. So go ahead.
An example of what, and it's the products that you were just talking about. So let's see if I can share this with you.
Jocelyn, you have some babies, right?
I have two. I have two human babies. I have one that's 20 and one that's 7.
And are they spraying too?
Yes, indeed. We're all on the products all the time. It's saying that you need to allow me to share the screen.
Oh, how do I do that?
Good.
What do I do? Is it under security? Allow participants to share screen. Oh my God, did you see that? I'm so techno savvy.
Amazing, really, truly incredible.
Well, you know what? It's become more and more kind of innate. Just like when I hand my kids something, well, they're all grown up, but they can, figure out how to use it without any instructions.
Yeah. Well, so this was brought to us by a practitioner. We didn't know that she was doing this, but this is a patient with dementia. And you can see here is a scan, brain scan, and red means that it's inflamed, right? So
what kind of scan is this?
I can't remember. I can get it to you.
I just wonder, because I'm wondering how we get these, whether they're available all over the place, or whether they're covered by insurance.
No, well, I doubt that it is. I can actually find the scan.
Yeah, I'm looking on here. So for the people who are listening, the topic is neuroinflammation, and there are baseline circles of areas of the brain on the left-hand side, and then the I would assume post-treatment on the right side, and how much more improved we've gone from many areas that look like they're on fire to more green and aqua areas. There's still some redness, but overall, I would say it's a 98% improvement. I don't know, I'm making that up, but it's drastic.
Well, so this is a QEEG brain map. That's what kind of test it is. I don't know anything about it. It was brought to us by, her name is Dr. Pamela Hyde. I think she's a chiropractor, and she was doing this, working with a dementia patient. And so before this patient had, you can, like Cindy just described, lots of red basically on the pictures of the brain, showing lots of inflammation. And then Dr. Hyde prescribed a gut treatment, right? And so what I love about this is that we're able to see the systemic reduction in inflammation by treating the gastrointestinal tract. And so on the right-hand side here, you can see that it's dramatically improved. Also, her dementia symptoms improved. So of course they were very, very happy with that outcome. And it's fun, it's an amazing thing
why not, right? Why not give it a whirl? Everybody's running out, sticking, all kinds of meds. I talked with someone who said more kale, less meds, but you shouldn't use kale if you've got issue, but
right. So that's where I'm like, this is where I find, this is where I get a little prickly around the way that the sort of the public policy is, I don't mind. I mean, I agree that we should be wearing masks, right? So that's good. But I also think, I just saw a sign that said, or a meme that said mandate vegetables. I'm like, yeah, and sleep, mandate those things too. There's nothing, nobody's paying attention on a public policy level to how's our vitamin D status? How about vitamin A? Are people getting enough sleep? Are we helping with stress level with our media in this country? No.
And this is what this is what has to come to light. This is what people need to hear over and over and over again. And this whole thing about direct to consumer marketing fries my fanny, makes me crazy. There should be no reason why all these companies are telling people how to get rid of their asthma, their eczema, blah blah. All they're doing is treating the problem without finding out what the underlying issue is. And I mean, what if somebody as a kid, you know they're at the ENT for chronic sinusitis and ear infections and whatever, and no one ever asked, tell me about your home environment. Have you ever had any water damage? Oh, does your house ever, you spend weekends at grandma's house and the basement is musty. Come on, come on, Ugh. So anyways, I'm just putting that thought out there. I think the only countries that allow direct to consumer marketing is the United States, and there's one other country. Everyone else, it's banned.
Well, I think it ought to be.
It ought
So
to be.
I'm with you there.
I gotcha. You know what, Jocelyn? I can't help but say I learned something from you every single time. And Biobotanical Research is so lucky to have you as their educator because you come from both sides of it. You can dive into the research and understand it from a medical aspect, but you can also relate it to your practice and how to talk to people. And so talking to people here on the podcast and teaching me, I think it's just such a valuable thing. So I appreciate it, and I thank you for being a guest on the podcast to teach us.
For having me and for your kind words. I really love what I get to do. So I'm just very happy with my situation.
I know, and you're sought after now, so I feel very honored because you've been working with Full Scripts, and you've been working with Dr. Kara Fitzgerald, and you're going to get big. So before you get too big, please remember this face and send me your autograph. It's going to be worth a lot of money someday.
Nobody could forget you.
Oh, I know. I make an impression. What can I say?
Blast. I love talking with you.
Oh, it's great. All right. Until next time, right? For everybody, you have been listening to another podcast from Living with Lyme. And if you would like some more information about me, then please go to www.pursuewellness.us. Check us out. Check our center out and what we have to offer you. And also, subscribe to either www.pursuewellness.us, too many W's, or and certainly prescribe. How do you like that? Subscribe to livingwithlyme.us as well. And until next time, please, people, wear your mask, wash your hands, stay safe. Go to the Full Scripts login on my store page of Pursue Wellness and get some biocidin products, I think, and spray away. Look at her. She's spraying right now, and I'm going to go spray as well. There it is. There it is.
That's great.
You got it. For everybody, mwah, stay safe.
Thanks, Cindy.
Bye now.